The question is, why now?
Treatment.
Yeah, what is different? Why now and why you?
Because look, I think that the audience matters in a
Mhm.
major way. I think there's a lot of commentary around patients becoming consumers, and on some topics they are, and other topics they're not. So the whole idea behind PHRs, which has never really worked, the thesis was wrong. The thesis was that if you give the patient all the information they need, they will consume it. Absolutely not true, right? You can give the patient all the information you want, they will consume it immensely the first week, and then it'll start to trail off where 90 days they'll stop looking at it. So I think the thing really isn't about organizing the data for patients. I think it's more about organizing the data for the provider, organizing the data for the PBM, organizing the data for the prepare, for the care delivery and coordination teams. I think that's where the value is, honestly, more so than overwhelming the patient with information that doesn't change very quickly and expecting them to engage with it on a daily basis.
That's a very interesting notion, right? Of patient being the consumer, because we talk a lot now about direct to consumer models. How much can we learn from consumer practices that have existed in outside of the healthcare, bring them in? But to Fawwad's point, right? Yes, patient interaction can be consumer like, and we should approach it that way. However, the back end systems, our CFOs, our CMIOs, they're not in the consumer world. If they're in the B2B world, trying to make decisions at a B2B scale that's not being done at the D2C level, right? So for us, the why Penguin was very interesting is because you could have a common ground to start talking to the C-suite level where we're talking about true governance platforms and how can we enable them. For us, the early interactions are more so of like we can have those unique niche cases that we can start talking about. But that's the get the foot in the door kind of use cases.
Yeah.
So now you can have B2B conversations at the executive level to say, well, I have this capability across the system that I can leverage. Then what can I do? That's kind of where we are.